Once you go live stream, yeah. Hello everyone, good morning, good afternoon and good evening, depends on where you are based. A very warm welcome to day 3 of the 3rd International Conference and POF Festival for Youth-Led Climate Action 2021. We are very delighted to have you all join us for one of the biggest youth-led events for climate action. My name is Komal Mittal and I'm from India. The POF family is excited to have you all to this session, which will focus on the topic Impact of Environmental Factors on Human Health. The connections between human well-being and health of the environment is becoming increasingly evident as we acknowledge that the health of the planet is inseparably linked with the health of its inhabitants. This session will discuss how human influence changes in environmental factors have lasting consequences for human health. It will also emphasize the needs to address environmental changes by adopting a health perspective and appreciating the complexity of life supporting system. We are very happy to have you all join us for this very meaningful conversation. Before we start, I would like to mention a series of indications. Kindly keep your microphone switched off to avoid any background noise. Please feel free to use the Zoom chat to send in your questions. Our facilitators will help us coordinate to respond to your queries. We would also like to share our social media handles to keep you informed about our future activities. You can find the same in the chat. We look forward to seeing you all and engaging with each one of you through the next 4 days of the festival. Once again, a very warm welcome to everyone. I hand over it to Drishya now.
Thank you, Komal. So to start with, I would like to introduce our esteemed experts who are present at the event. I would first like to invite Dr. Izarelly Pantoja, a Doctor of Law from the Autonomous University of Querétaro. Dr. Izarelly is a researcher and a trial lawyer in human rights, climate change, and environment. She is a part of the WSDF local organizing committee, and during her career, she holds the record for the development of 20 local laws and 3 international laws for Mexico, as well as their impact on the development of various plans and programs in the field of environment. She has worked for various international and national organizations and authorities such as World Bank, International American Development Bank, Germany Agency for International Cooperation, GIZ, Japan, International Cooperation Agency, JICA, Ministry of Environment of Peru, Dominican Republic, Semanat, Chamber of Deputies in Mexico, local government, and much more. She has received various distinctions due to her experience in the field of environment. They include Ignacio Ruiz Collado Fresa Distinction awarded to distinguish Querétaro people in the year 2019 by AGPHI Municipality of the Municipality of Querétaro. Over to you, Dr. Izarelly. Dr. Izarelly.
Thank you very much, Drishya. Buenos días a todos. El día de hoy vamos a dar inicio a este panel tan importante y el objetivo es hablar precisamente del cambio climático y la salud. Durante los últimos 50 años, la actividad humana, en particular el uso de combustibles fósiles, ha liberado una gran cantidad de CO2 y de otros gases con efecto invernadero. Esto ha quebrantado y alterado el clima mundial, en donde en los últimos 130 años se ha calentado aproximadamente 0.85 grados. Y durante los últimos 30 años, cada década ha sido más cálida y en cualquier década es importante reconocer los impactos del cambio climático en todos sus aspectos. El nivel del mar también está aumentando, los glaciares están fundiendo y el régimen de lluvia está cambiando. Cada fenómeno meteorológico se ha convertido más extremo, cada vez más intenso y frecuente. Aunque el calentamiento mundial puede tener algunos efectos localizados, como una menor mortalidad en el invierno, las regiones templadas y un aumento de producción de alimentos en zonas determinadas tienen efectos globales para la salud y el cambio climático será posiblemente todavía más negativo en estos impactos. El cambio climático influye en determinantes sociales y medioambientales, como por ejemplo un aire limpio, un agua potable, alimentos suficientes, una vivienda segura. Y las temperaturas extremas del aire se convierten directamente en defunciones por enfermedades cardiovasculares y respiratorias, sobre todo para las personas de avanzada edad. La ola de calor que sufrió Europa en el año 2003 y que volvió a repetir, se registró un exceso de mortalidad cifrado en 70,000 defunciones. Las temperaturas altas han provocado un aumento en los niveles de ozono y otros contaminantes que se agravan, especialmente por enfermedades cardiovasculares y respiratorias. A nivel mundial también el número de desastres naturales relacionados con la meteorología se ha triplicado en los últimos 60 años y estos desastres causan más de 60,000 muertes, sobre todo en los países en desarrollo. Esta creciente variabilidad de afectaciones a la salud ha sido incrementada en los casos de escasez de agua, con sequía, hambruna, y reflejan el grado de intensidad que se está alterando a la salud humana. Todas las poblaciones se verán afectadas por el cambio climático, pero algunas son más vulnerables que otras. Los habitantes de estados insulares en desarrollo o también economías emergentes como México y otras regiones costeras como la megalópolis y regiones montañosas son especialmente más vulnerables. Una atención particular tiene el tema de salud pública en los niños y en particular en los países con pobreza o extrema pobreza, ya que son las poblaciones más vulnerables a los riesgos sanitarios resultantes que se verán expuestos por más tiempo a cuestiones sanitarias. Se prevé que los efectos en la salud serán más graves en las personas mayores y con diversas dolencias existentes. Las zonas con infraestructuras sanitarias deficientes o un esquema de salud por demás bajo estándar de acceso efectivo al derecho a la salud nos ponen con dificultades para prepararnos para las próximas pandemias. Por ello debemos considerar que el cambio climático influye en determinantes sociales, medioambientales, y que se prevé que entre el 2030 y el 2050 el cambio climático causará más defunciones debido a la malnutrición y otros efectos. Es importante trabajar desde un sistema de salud pública para fortalecer la infraestructura sanitaria, especialmente en los países con menores capacidades para adaptarse a estos efectos. Las políticas públicas en materia de salud pública deben establecer indicadores efectivos de acceso a la salud, específicamente en poblaciones más vulnerables. El papel de las universidades no solamente es poner la ciencia a disposición para garantizar el acceso a saber y entender, sino también fortalecer un vínculo entre la entidad pública, el gobierno y las universidades para que se siga invirtiendo a través de un fondo especial el fortalecimiento de la ciencia para posibles futuras pandemias vinculadas también a la degradación de la biodiversidad y el cambio climático. Agradezco al movimiento POP, al doctor Ash y a todo el equipo de la Universidad Autónoma de Querétaro por estar aquí el día de hoy. Este foro tiene como finalidad establecer las conexiones entre la salud humana y el medio ambiente para poder intensificar cambios efectivos en la política pública y determinar los factores y las consecuencias que puede tener en la salud humana las perspectivas sobre el tema medioambiental. Bienvenidos a todos y muchas gracias.
Thank you, Dr. Izarelly. Just to mention what she just addressed in the keynote, she talked about how the rising temperature is causing effects to the environment in form of like increase in the temperature, affecting the rainfall, creating food scarcity, creating droughts, and also impacting the human health. She also covered how areas with poor health infrastructure in developing countries will have the hardest time in preparing and responding if they do not receive the assistance. She also reflected on how between 2030 to 2050, climate change is expected to cause an additional deaths, which is way beyond what we are what we are or what we are going through today's disaster. She also mentioned about mentioned about reducing greenhouse gases emission through improved transportation and food and energy choices can lead to better health, and particularly through reduced air pollution. Talking about public health policy, she mentioned that they must be established in an effective way where we have specific indicators or to access health, especially in population most vulnerable to climate change. So thank you so much, Dr. Izarelly, for this special keynote address, and you're reflecting on multiple dimensions of how rising in temperature is actually giving rise to multiple factors that are ultimately affecting the human health. Now I would like to invite Dr. Isidro. He's Master of Science and currently holder of several subjects in Faculty of Medicine UAQ, Medical Advisor COVID UAQ Clinic, and AGPHI and NYU UAQ Satellite Laboratory Project. He was born in Mexico City, trained at the National Autonomous University of Mexico at the undergraduate level, graduating in 1982. Continued his specialty studies in the HR of the ISSSTE, doing the specialty in pediatrics with subspecialty in pediatric hemato-oncology. He settled in the city of Querétaro, where he combined his medical professional activity with the practice of teaching both at the upper secondary level and in the different faculties of other university. He is the author of several scientific articles and publications. With that, I would like to welcome Dr. Isidro.
Thank you so much. Thank you to the PUP movement. My English is really bad, so I'm gonna do something that I love very much. I'm gonna switch from Spanish to English, and wherever you try to follow me. My English is really poor, but my Spanish is worst, so don't worry, you will enjoy that. Can I share the screen? Because I want to show you something that my group wrote 20 years ago.
Please come.
Thank you. Oh, technology, I hate it. It's horrible. I am from another century. It's difficult to me to start. Yeah, I have it. Let me see if I can start this. It's just few slides. So let me start. I don't know what I do. It's not showing. Yes, yes. Okay.
We can see the slide.
Yes?
Yes.
Perfect. 20 years ago, I was talking with a little group of students, and we decided to make a club. The name of the club was Public Health. Why is so worried? Because no one in the clinical field likes to study public health at that time. They said that it's like another discipline. We don't need public health. We need to take care of patients. And we start talking about this, climate change and health. You know, Hippocrates was describing that the environment defines the behavior of the people. And he was right. So we need to study our environment to talk about individual health, because the individual health is just a resultant of the public health. So yeah, maybe it's boring, but we need to know about it. What is our problems? 20 years ago was our type of society, our energetic model, our mobility model, and our food systems. In that moment, the transgenics was the issue. At that moment, the long distances and the possibilities of having things from Gujarat in the table of Querétaro, or to have people from Poland visiting Shanghai or wherever. The world is shrinking at that time. So that was the moment to think in the global health. And that's why I am focused in teaching to some other peoples the importance of the global health. The other is the inequity. Our model, as all the models, has many, many inequities. We are not a family, and we need to be. Talking about our society, 99% of all that we have around us is garbage in 6 months. But we designed the things like that because we needed to maintain our system. A bad system, yes, but the only one that we had. Dr. Izarelly talks really, really better than me about the problem with the carbon dioxide in the environment. And we are talking just about less than a grade of increase in temperature. And the changes are dramatic. This is more of this, it's just a reflection about what is happening with the other living things and because of our behavior. You know, the genetic changes in plants and animals produced because of this less than a grade of increase is amazingly powerful. If you imagine the model of, I am a really losing drawer. So if I think in America, I think in 2 triangles, and they are touched just in one of the peaks of these 2 triangles. If we follow, for example, Aedes albicuntus, an insect, he stops in that vertex of the triangle. So yes, the Latin American countries have a lot of problem with dengue, Zika, chikungunya, but don't go far to the north because of this climate difference. Now you can find this insect even in Canada. Good for us. We change the climate and will allow our invited or not invited guests to be in places that we don't expect and in which we don't have defenses. Directly, as Dr. Izarelly says, heat, weather, catastrophes are related to the climate change and affect directly to the excess of mortality in different countries. But also we are changing our ecosystems. So all the insect vector transmitted disease are now moving in different locations. When Dr. Livingstone was founded by Stanley in Africa, he just not discovered the place of Dr. Livingstone. He also discovered the place of many viruses. So maybe we need to make a new statue to Stanley. And instead of remember Dr. Livingstone, I suppose, we need to say Ebola, I suppose, or HIV, I suppose, or Nilo fever, I suppose. So when we visit other places and we embrace our nature, we change that places. And that's part of being human. We change the ecosystems. We have that power. The big problem is we don't have the knowledge. And sadly, really sadly, these ecosystem changes also change the social systems. So we now have migrants because of climate change. We have displacement of population. We have more inequity with the more poor people, but also with the gender. It's understandable that the real founders of the human society are the women. And they put much more effort than the men to do these social constructions. But also they carry more and more problems to them. What we can do? We can mitigate, we can adapt. We talk a lot in this week, I hope, about mitigation and adaptation. Because we need to do something. But, okay, we will do all of this, more or less. But the main problem is, what can I do? What is my goal as uno de los principales responsables de cambiar el clima? Porque cada uno de nosotros es responsable de cambiar el clima. Tengo que ser más inteligente. Tengo que tomar medidas que beneficien a los demás. Tengo que usar transporte público. I need to change my diet. I need to do, you know, in Mexico, we used to say, have a kid, plant a tree, write a book, and your life is complete. Well, we can start planting a tree. I think it's kind of easy. Well, Querétaro is semi-desertic, so you need to put a little care, but it's feasible. Kids, we have a lot. So the third is, if you cannot write a book, share a meeting in pub, and you will be complete. Talk about climate change with everyone. More people is aware about the climate change, more changes we can expect in favor of our common house, our oikos. And the other, for the ones that are interested, is to make research in public health, in global public health. We need to evaluate our vulnerability, our adaptation, which problems we have and how we can make changes. Did we have enough information? And then we need to formulate policies. Policies are not well in the hands of politicians. Needs to be in the hands of people with interest. Okay, that's I think that's enough. So my problem with you and my problem with me, we are talking about this from 20 years. And still, we lost one grade. We need to do harder, quicker, and better all the mitigations and all the adaptations to stop this climate change. Thanks for hearing me.
Thank you so much, Dr. Isidro. Before I conclude what you said, I just wanted to ask the audiences whether everybody can see the subtitles at the bottom for the translation. If not, you will have to switch it on your own. There is CC written, which you need to switch on to get the transcription that is going on. So thank you so much, Dr. Isidro. I think you reflected on how the ecosystem changes can also lead to the change in the social system, how it is affecting people, their livelihood, their survival, and how mitigation and adaptation needs to be done. But what you actually focused on is very, very important, which is that what I can do at my level, and that it is our responsibility to be part of the climate mitigation and adaptation and consider it as priority. So thank you so much. With that, I would like to invite Dr. Chris. Dr. Chris leads the Global and Environmental Health Program at NYU School of Global Public Health. GEPH is the largest academic entity within GEPH, and more than 220 students, 3 MPH degrees, 3 certificate programs, and 9 faculty members are there. Dr. Chris is an international development innovator and public health entrepreneur whose work seeks to develop sustainable public health models and to forego bonds between the academic community and practitioners in the field. He sees the challenge facing public health, vast health inequities, applied skill gaps among the public health professionals, weak community health system, and shrinking research budget, and seeks to reimagine sustainable solutions through a multidisciplinary approach. Through a learning model that combines system thinking, bottleneck analysis, innovation, and implementable projects in partnership with WHO, UNICEF, WFP, and several universities in the Global South, Dr. Chris leads a series of courses in which international public health professionals and public health students learn and work together on real-world problems. Additionally, Dr. Chris founded and mentors the Applied Global Public Health Initiative, where students have the opportunity to work on a series of projects on behalf of global public health sponsors. Dr. Chris has a Dr. PH from Mailman School of Columbia University and an MBA from Mtro School at the University of Pennsylvania. Earlier in his career, he co-founded a company that provides clean water and primary care in villages in northern India. I welcome you, Dr. Chris.
Thank you. Thank you very much. Thank you to the Pop Festival and to all of you for your amazing work on raising consciousness and keeping us all focused on the importance of climate change and health and really the changing world. And so I'm very grateful to have been invited. I'm very, very grateful to be able to follow somebody as great as Dr. Isidro and also Dr. Izarelly. So I hope that this will be a good addition to the work that they've already been able to show us. I'm just going to put my timer on and I'm going to share my screen because as my students will probably be surprised because I never show slides. I'm going to use slides because we have a relatively short time to be able to talk today. So I'm gonna, hopefully you'll be able to see my slides here. And I would also like this to be a conversation. So I really encourage anybody who would like to respond or to interact to please do so. I would say that the way we look at the environment and health is as a series of interconnected challenges and factors. And this was in existence before COVID. It will be in existence after COVID. And one of the dangers of a global pandemic that's taken all of our attention for the last year and 4 months is that sometimes really important challenges, particularly health challenges and environmental challenges, get pushed aside a little while we focus on trying to protect ourselves and our communities and our loved ones, and still be able to bring in income and to be able to go to school and to do all the things that we're supposed to do. And so the danger is that the importance of environment and health can be pushed aside a little, but those problems are not going away. They're still there. And in fact, the same risks that made an individual more likely to become infected with COVID, a lot of those same factors are there to make somebody more likely to be impacted by environmental challenges in their health. So I'm going to show you a slide. This is these 2 slides are from the WHO. They're a little bit dated, but I just want to really underscore how important environment and health and the connection between environment and health is that 1 in 4 global deaths, this is before COVID, but it's not going to change all that much after COVID. 1 in 4 global deaths are explicitly linked with environmental risks. And if you think about it, that's spread out across the world and in all of the areas that we are joining this conference from. There's a significant increased risk of dying early because of environmental factors. And those diseases that affect us that are related to the environment affect all of us. And so if you look at heart disease or respiratory disease or cancer, all of these illnesses have a very distinct environmental component. But the goal of this conversation today is not to show you the data, but the goal is really to help convince you that all of these factors are connected to one another. And so if we look at the Sustainable Development Goals, which are a series of goals and targets that were agreed upon by 195 countries in 2015, to be able to strive to work together to try to achieve some goals that at the time we all thought were achievable and very important. And so what's interesting about the Sustainable Development Goals is that 195 countries means that we had rich countries and poor countries all working toward the same targets. And then the other interesting component is that these Sustainable Development Goals were across an entire spectrum, from clean water to sustainable cities to gender equity to poverty to peace and justice to partnerships. And so you have a very wide range of these goals that, as I mentioned, affect rich countries and poor countries and low and middle income countries. And that these are challenges that all of us who share the planet in some ways are motivated to try and address. For the purpose of this conversation, I would like you all to just realize that these goals are interconnected, that they're not just goals, that achieving one, for example, no poverty, and not working on the others is likely not to really benefit sustainability. In order to really make a difference, we have to look at these as interconnected, as components that work together to make the world and make our own worlds, our own lives better and the lives of our communities better, so that working to reduce poverty and working to reduce gender inequity and working to improve the environment and working to improve health outcomes, all of those goals are interrelated with one another. This is different. This is different for your generation than it was for mine. You could make a career when I was growing up in public health in a specific area of public health. You could be an immunization expert or a nutrition expert or an expert in child health. And you could make an entire career and work very well and have an income and make a big difference in improving those outcomes by focusing on one area. Your generation doesn't see it that way, I think. I think that you see the world in a much more interconnected way, and that by focusing on one area, you're really not helping the major problem. And I really think that because young people see the world in such an interconnected way, it gives me great hope for our ability to be able to address these challenges. So one other aspect that I'd like to just stress is that the social determinants of health are also interconnected. And we talked earlier, Dr. Izarelly talked a lot about how the environment is an important component of the social determinants of health. And what I mean by this is that there are communities that are especially vulnerable to the effects of the environment, not by their choice, not because of anything they did, but purely because of where they live and because of the poverty in that area, or because of the environmental risk in that area, or the neighborhood that they're in, or the built environment, the type of housing that's there. So we look at it at NYU in this sort of holistic way, that these are the social determinants of health are interconnected in the same way that all the other health indicators are connected to one another. Next two slides are my last two, and then I'll finish. But I wanted to show you what that means at NYU among our students. So what we would do is we would create a map of a risk. So in this case, this was a map that was created by a group of students at NYU. They were looking at why a particular group might have more food insecurity than someone else. So they were looking at reasons why vulnerable individuals in a population would be more food insecure. And they started to map what all of those factors are that lead to food insecurity. And so, of course, they looked at food prices. So as food prices go up, so does food insecurity, because people can't afford it. Or as the climate changes, as Dr. Isidro said, and people have to travel farther to be able to get the diet that they're accustomed to or that will keep them healthy. But the climate change is another important component. The availability of fresh produce, which has to do with the agricultural availability, but also the supply chain and the ability to deliver products to people who are ready to be able to consume them. So what we've done now is we've built over the course of these slides is this idea that everything is interconnected at a global level, but even at a community level, the connections are there and quite complex. And if we don't respect this complexity, if we don't try to understand what will happen, for example, if food prices go up, or if the number of food deserts increase or decrease, if we don't try to see what will happen in that instance, it's going to be very, very challenging for us to be able to address the impact, the food insecurity or the health impacts of having food insecure populations. And so the last slide that I want to show you is really that it's not even just about making a change, it's about understanding where that change probably needs to happen. So if we think about food insecurity and why a family might be food insecure, in other words, not have access to the range of products that will keep them healthy, we would look at it in terms of a bottleneck analysis, or what are the barriers for a family living in Querétaro, let's say, or living in Mexico City, or even in New York City, from having access to the full range of food commodities that will keep them healthy. So the first level that we look at is the availability. So are they even available in that community? And if they're not available, then that's a bottleneck. That means that no matter what we do in terms of trying to increase demand, we're not going to be able to help people because they just can't get access to those commodities. The second is are the people available to be able to deliver those commodities? So we could have plenty of healthy fruits and vegetables, but nobody to be able to stock them in the store, or not enough people, or to sell them, or to deliver them to the restaurants or to people. They may not be accessible to some individuals. It might be that the bottleneck is really that it's there, but people don't have transportation, or the roads are maybe not good enough for people to access to be able to get there. So we would look at this as coverage determinant. So is the food there, or is it accessible to people living in the community? And each of these, as you can see with the red area is a bottleneck. In other words, that the people who are in the blue, if you wanted to look at this, that 60% of the people in this sort of sample community would be able to access a full range of food items to be able to keep their family healthy. So these are just coverage. This is just what people would have access to. The second layer, though, is that you might have access to it, but the families may not be able to afford it. So the financial affordability is a really important bottleneck. And so we would look at that as, there's plenty of food there, but the people living in that region aren't able to afford it. We saw this in Madagascar a number of years ago, and unfortunately it's going on at the very moment that we're on this call. But there's a very significant shortage of food in southern Madagascar that's leading to the risk of starvation for quite a large number of people. We visited that a few years ago, and we saw that there were markets that were selling food, but because the amount of food, the type of food there was so limited, the prices were very high. So only the wealthiest people could afford a good enough diet to be able to support their families. So that's a very significant bottleneck. The next level is that it's possible that we've got enough food in a particular geography, people can afford it, but it's socioculturally not acceptable. And we see this often for the best intentions, that aid agencies might deliver boxes or crates of food in areas that are resource poor, and it's food that's just not part of the culture there. And so the individuals, may not know or even want to be able to, have this type of a food delivery, let's say. So sociocultural acceptability is another major potential bottleneck. And then the next level for us is it there when people need it? Is it there around the clock? I mean, you can deliver it once, but you may not have enough food when people really need it. The drought in southern Madagascar lasts for 3 or 4 months. And so it would mean that the diverse diet would need to be there for quite a long time if we were trying to make sure that people were covered the whole time. And then the last one is really the quality of the food. So if there's a lot of rot, there's a lot of transport, spoilage. And so we might have food there, but it just may have already gotten bad and it may not be appropriate. Understanding where the particular bottleneck is in a particular community is really important, because it will help us waste time and waste resources addressing a bottleneck. So for example, if the bottleneck is in availability, we would like to try to get more food there. If the bottleneck is in the price and the financial affordability, we probably want to subsidize the food. We'd like to find a way so that we can make the food cheaper. If the quality is, if the bottleneck is in sociocultural acceptability, we probably want to have an educational program or some kind of a communication program to let people see that this is something that's helpful. So it lets us target our response, our strategy, to try to overcome the environmental risks the environmental health risks in a way that avoids wasting precious resources. Resources are very, very limited in public health. And so we want to make sure that we deliver them to the right people at the right time and in the right place. So this is the end of my presentation. I'm very grateful, as I mentioned, to be able to have this time with you. I look forward to interacting with the panel. And thank you to the young people watching this for putting your attention toward this incredible challenge that the whole planet faces.
Thank you, Dr. Cruz. I would like to ask if anybody has any questions specific to the presentation that Dr. Cruz shared, please go ahead. And the final round of questions will definitely happen towards the end, but for now, any questions related to the presentation and the data that he presented? Okay.
Dr.
Is there any
Izarelly is
question?
having a question.
Yeah,
You're making
please go ahead, Komal.
Having a question, he just turned.
Sorry, Komal?
Sorry, we
I
can't hear
think-
you.
Can you hear me? Yeah, Dr. Izarelly, please go ahead.
Please, Dr. Izarelly. Por favor.
Oh, we can't hear you,
We
Dr. Izarelly. Do you have any microphone connected? Because you are unmuted, but we can't hear you.
I think maybe, you know, the microphone thing is switched off.
It's on.
No, I mean on the keypad.
Yeah. Can you disconnect your
Or maybe type it.
your-
Type the message. Si es posible, por favor. Gracias, doctora.
Dr. Isidro, meanwhile, would you like to ask a question?
First, I want to celebrate the speech of Dr. Dickey, because I think it's really important that we, the people that try to teach or try to make a conscience about these interconnected problems and how to approach that with a systematic thinking are really important. I honor Dr. Dickey because he teach me a lot about systematical thinking in the public health and how to make this really, really interesting. Not only not boring, but interesting at a higher level. So thank you so much, Dr. Dickey.
Thank you, Dr. Isidro. You teach me a lot every day too. Thank you.
¿Ya se me escucha?
Sí,
Yes,
muy
we
bien.
can hear you.
Gracias.
Gracias.
Thank you very much, Dr. Isidro and Dr. Dickey. Solo tengo una pregunta. Él hablaba también de los factores e impactos más importantes, ambos, en el tema de la salud. ¿Cómo establecer una política pública, por ejemplo, para los migrantes ambientales, los desplazamientos ambientales? Hay mucha gente que no tiene acceso a la salud, pobres, migrantes ambientales o también personas en situación de calle. A ellos no les llega esta política pública. ¿Cómo fortalecerlo para que se pueda lograr esta situación?
Yeah.
Good question.
Muy bien, sí. Gracias.
I think the best approach is what is happening with Vanuatu. They are a small island. It's about up the sea level, and they are condemned. They will need to move sooner or later. what will we do as a complete world? It's not question of misericordia or charity. It's about to make policies of social consistency, of that the damage that is make it to a migrant population, to a disadvantaged population, is the same damage that I receive as a people with access to all the health and the welfare. So we need to make more public policies that make all equal. Maybe sounds socialist, but it's not socialism. It's humanity.
Yes, sir. I think that's an important point. I think also there's an issue with a lot of climate refugees and particularly access to healthcare. Clearly, there are a number of issues that need to be dealt with, but dealing with it at the policy level as well as the regulatory level would be critical. And of course, I think the issue of the interconnectedness, which has been underscored, is very important because we need civil society also to be involved. So thank you for your insight. Thank you. Dr. Chris, would you want to add anything in terms of the issue of climate refugees and particularly access to health, especially as please.
Thank you. Thank you very much. I think that the lesson that we've all learned in this time of COVID is that all of us are connected to one another. There's no way to escape from it, really. Even the wealthiest people had risk of COVID, and it was there because the risk was shared by all of us. And so I think if we can keep that lesson that we are as much at risk as the person who's most at risk in a situation like COVID, it will help us be a little more accommodating to those who maybe aren't traditional members of our state or our community. There are countries that are already aware of that are already providing health benefits to everyone within their borders, regardless of whether they're migrants or citizens. And I think that's the right way to do it, because if you have a population that's within your borders that is carrying with it an increased risk, that they're just bringing that risk inside. And so it is, as Dr. Isidro said, much more than charity. It's really a recognition, it's an understanding that it's all connected, and that by ignoring that, you're only increasing risks. You're only making the problem more difficult to solve in the long run.
Thank you, Dr. Chris. I think your presentation on how all these issues are interconnected and what are the bottleneck areas, particularly to the presentation you made, the data that was collected on food security and the crisis, is really helpful to understand that how other such issues can also be tapped into and created in form of a map to better understand how they are interconnected. So thank you so much for that. I would like to now invite Maestro Oscar and Mauricio to make a presentation together. Dr. Oscar, born in Querétaro, Mexico, received his medical doctor degree from the University of Queretaro. There he was president of the Student Council and the Students' Federation. During his time there, he saw the relevance of public health interventions and how important it is to innovate and be part of them. Dr. Oscar began to get involved with NGOs like the Newborn Foundation and implemented the Born Project in Mexico. With this perspective, he decided to pursue a master's in global public health and advanced certificate in public health disaster science. He co-coordinated and now advises the Applied Global Public Health Initiative from NYU School of Global Public Health. The AGPHI built satellite labs at the NYU Abu Dhabi and Querétaro, a climate change task force, and the most recent project, the International Summit on Climate Change and Public Health. His commitment to making a change is a value that has been reinforced throughout these projects, highlighting that every intervention must be built from a local perspective. Mauricio, a student of medicine and active member of Satellite Lab AGPHI, University of Queretaro, was part of the project Integrated Control of COVID-19 through Immunomolecular Diagnosis and Vaccination in the medical follow-up area from the University of Querétaro Integral Attention COVID Clinic, active member of the Satellite Lab of Applied Global Public Health Initiative in the climate health area, project leader of the first AGPHI International Summit of Public Health and Climate Change of the University of Querétaro and NYU School of Global Public Health. Welcome, Dr. Orozco and Mauricio.
Thank you very much, Drishya, and thank you everyone for being here. It's an honor to be sharing the stage with Dr. Isidro, Dr. Dickey, Dr. Izarelly, and obviously thank you, Dr. Ash, for everything you've been doing and how you been supporting us along this movement here in Querétaro and with the conference. If you can let me share my screen, please, so I can. Very brief presentation.
Sure, sir. Please try. Are you able to share your screen?
No, I'm not.
Can you try?
Now, yeah. Thank you very much. So we're going to be very brief. We initially, when we began preparing this presentation, we had this idea that sometimes talking about climate change and human health, it's very difficult and it can be sometimes shocking. Sometimes we might think that this, instead of motivating us, it can be a bummer, and that's why we try to focus this on something different. We try to make this a very brief and an optimistic one, so that we can be motivated. And I just like to make you remember these three words that we will mention a lot, that it's how union, division, and also this systems thinking and systematic approach. And first, I like to give this image that most of you might know about this concept of One Health, how everything is interconnected, and this unified concept, which has these three cornerstones that we can see here: the individual health, the population health, and the ecosystem health. If we don't have an ecosystem that is healthy, it's going to impact these other two areas. And you can see here also in how the umbrella is covering the environmental health, the ecology, even the veterinary, human medicine. So it's everything that should work as a system. And this is how we need to mix it and work for it. Because if no, we can see that every factor inside this chain of effects will impact human health. Like a common denialist, climate change denialist, they say a lot, why should I care if I'm not going to be directly impacted? It's going to be my children, my future. But no, here we can see that if we have more extreme weather, the air pollution, and will impact your asthma or your any cardiovascular disease, and that will be short term. Now, Mau, please go deeper and see how tell us how this evidence, how evidence divides these effects.
Yes, thank you, Oscar. Thank you, everyone. Talking a little bit more about the effect of climate change in human health. In terms of effects, we have these three pillars that are direct and indirect mechanisms and interaction they have between them, and social dynamics to produce health threats. The direct effects of climate change include increased heat stress, floods, drought, and increased frequency of intense storms. With the indirect, we can include population health, that changes in air pollution, the spread of disease vectors, food insecurity, and undernutrition, for example, or mental ill health. So the magnitude and the nature of health impacts are very hard to predict with precision, taking in consideration these three pillars. However, it is clear that they are pervasive and reflect effects on key determinants of health. So small risks can interact to produce larger than expected chances of catastrophic outcomes, especially if they are correlated. So is important to consider talking about the effects of climate change in human health.
Now, as you know, and like we mentioned before, in the first slide, we mentioned about union, but now let's divide, let's look at it in, like Dr. Dickey showed us, in a systematic way. And here's one example of it. As you may all know that the Lancet, this peer-reviewed magazine, every year makes a report. The latest was the 2020 report, the Lancet called Countdown, on Health and Climate Change. The report shows 43 indicators, and they have five sections: climate change impacts, exposures and vulnerabilities, adaptation planning and resilience, mitigation actions and health co-benefits, economics and finance, and the public engagement, the public and political engagement. Now let's make a connection inside these, the indicators that each one of them have in a linear way. The indicators are 1.1, 1.1.1, etc., etc. But here, if we see how we can connect them, maybe this is not the best approach, but it was a very, one like really superficial, so that we can see this interconnectedness even inside these reports. Health and heat, how they are related, the next indicator, vulnerability to the extremes of heat, the next indicator, exposure to vulnerable populations to heat waves, and we go and go and go. In the second group, how adaptation planning and assessment goes, the next indicator, national and adaptation plans for health, then this assessment on the climate change impacts and the vulnerability and adaptation. We can see in the third one, how this food, agriculture, and health, like Mau mentioned previously, the emissions from agricultural production and consumption. And now another important thing that please remember, the diet and health co-benefits. Then we have also a series of different indicators in the group 4, the health and economic cost of climate change and the benefits from mitigation, which economic losses are producing and how's the economic burden. And also finally, the group 5, that is this public and political engagement. Now let's connect, let's begin. For example, if we put a boost of energy in our group 5, how we like this type of conferences and this type of sessions, we put a lot of in the public engagement. This will impact directly into mitigation actions and the health co-benefits, because people will be engaged, will begin to do something. Now, if we impact the mitigation actions and the health co-benefits, we'll improve our economy and will improve the financial systems inside the countries, which at the bottom line in the governments, that's the important thing for them. And that we can build, adapt, plan, and have this, please remember also this word, resilience for health. And then we can impact the first point, the climate change impacts, and reduce these impacts, reduce the exposures, and improve and reduce the vulnerability, But we also may ask ourselves, what is my role? What is my role? What am I doing? What can I do specifically?
So talking about what can I do specifically, we want to talk about the health community role, that if we see along history, the health professionals have worked to protect in different occasions against health threats. for example, tobacco, HIV, AIDS, polio, and different vaccinations campaigns, as we can see now of COVID situation, that the leadership is taken by the medical professional or the health professionals. So in this case, about talking climate change, this cannot be the exceptions. Health professionals have to be or must be leaders in responding to health threats of climate change. And doing this in a public health perspective, it has the potential to unite all sectors in a common way. So this has to be the central idea, so we can adopt mechanisms that make easier the collaboration between the health professionals and the policymakers or other government departments to empower health professionals and ensure that the health and climate change will be considered to going in an integrated in government strategies. So this is a really important part to take in consideration.
Finally, we're just about to finish. These words that I make you, like I told you to remember: resilience and adaptation. This word has been out there for a long time, but it has been echoing later, and it's the ability of a human or a natural system to withstand and the impacts of exogenous shocks, and to cope with or rebound from them. It encompasses like the whole capacity of the system to build back stronger. So this is why we need to, here we put this climate change, climate resilience framework. It's from an article from Flood Resilience in India, how they built some shelters. And I want you to remember how we begin with the system on the Lancet report, that it was the public engagement. Here you can see how the local knowledge and the scientific knowledge merge, but they need a catalytic agent. That catalytic agent must be us, the young people who can mix this scientific knowledge, this local knowledge, make this shared learning, and improve the resilience in our systems, to improve the adaptation and build back stronger. And this is just a small insight on how this is a big topic on resilience, but we just wanted to highlight this. And what will bring you, or what will bring us, what will be this change, what if we do it now, Mau?
Yes, well, there's a lot of benefits of reducing climate change effects, but just to make an example of as Dr. Izarelly told us about burning fossil fuels, if we reduce, fighting climate change can protect us from the direct and indirect impacts of climate change. However, it also benefits human health through mechanisms independent of those relating to modifying climate risks, and these are called health co-benefits. And so, taking the example of the fossil fuels burning, if we reduce pollution, so the respiratory disease will reduce, the safer active transports, we can cut road traffic accidents, the obesity will be reduced, diabetes, heart disease, strokes. So health implications could and should be more effectively harnessed in efforts to build support of a stronger response to climate change, not only because of the climate change itself, but also because it's a win-win. If we reduce climate change effects of itself, we can reduce the effects that it will have in human health as an indirect effect. So, and this happens not only in human health perspective, it is an intersectoral benefit for all sections. It will be a benefit in agriculture, in economy, in policymakers. It's a win-win to take action in climate change. So in an intersectoral way, we will benefit in several ways.
Thank you very much for your attention. We're very happy to be here. And we would like to close with this quote for everyone. I don't know, Mau, if you want to say something, and thank you.
Yes. Also, thank you very much to the POP movement, to Dr. AGPHI and everyone here, to Drishya and the committee that invite us. So thank you very much. And as Oscar said, we're very glad to be here.
Thank you, Dr. Oscar. Thank you, Mauricio. We very closely work with the community, and I'm sure Dr. Ash later will definitely reflect on that. And you talking about how local knowledge and scientific knowledge can when come together, and that shared knowledge can bring and help us creating a framework for resilience, which can further lead to so many co-benefits if we put them into the public health system is I think very, very valuable. And with that, I would like to ask our own very young Alexia Muñoz, who is a pharmacist, biology and chemistry student from University of Guadalajara. And she has a lot of interest in climate change and public health, to make a presentation on entry microbes. Alexia, can you hear?
Hi. Yeah, I'd like to presentate. Can I do it, please?
Okay. Let me see. Can you do it now?
Yes, thanks. I don't like technology either. Where is it? I see it. Can you see now my screen?
Not yet, Alexia.
Not yet.
Yeah, now we can.
Okay. Well, hello everybody. I'm going to talk about the correct disposal of medication in Mexico. And I like to begin with what is a medication. So according to Mexican regulations, all kind of medication and therefore drugs are considered hazardous waste by the General Law for the Prevention and Management of Waste, and therefore the disposal must comply to the procedures established with the corresponding sanitary and environmental regulations. The Secretary of Environmental and Natural Resources, in Spanish, Semarnat, is in charge of this management in synergy with the Federal Commission for the Protection Against Sanitary Risk, which is COFEPRIS. And you're probably wondering what could happen if we dispose of medication like any urban solid waste. Well, a lot. I will be very brief and talk about some of the consequences of this practice. And the first one, we can say that they can damage the soil and its components. In addition, if they mix with the drainage and they contaminate the water when it reaches and flows into rivers or lakes. And it's super common that families, Mexican families, they dispose of their medication, they only throw it away in the drainage. Then that's very dangerous. And it also can damage our flora and fauna. For example, we have some hormonal medication like ethinyl estradiol, which is an anticonceptive that causes changes in the hormones of fish, causing feminization or masculization of the organism. And also there is a well-known case in the subcontinental India, that the use of diclofenac in the treatment of cow muscle pain caused the death of millions of vultures. They died because of kidney failure, and the species almost got into extinction. And there is also side effects of medication that can be extrapolated to other vertebrates. For example, we have some antibiotics to be known, they could cause ototoxicity to human. So it can cause also that into other species. And there's also the consequences of antimicrobial resistance. And how do the bacteria get to know these medications? Well, the bacteria could meet the medications in the garbage dumps or in the same environment, as I said, in the lakes or in the rivers. And there are various mechanisms by which bacteria could present resistance to these drugs. One of them is through plasmids, which is a small fraction of genetic information and specifically some resistant genes. So that's a super important problem. And sadly, the persons who are in contact with these resistant bacteria are the public servers, the ones that are work in the garbage dump. And last but not least, we have that the black market takes advantage of the expiration of these products for their commercialization, especially those that aren't sold without a medical prescription. And there is the case of in 2017, in the state of Veracruz, there were found 11 tons of expired drugs for the treatment on HIV. And unfortunately, that cifra is only because the COFEPRIS found the medication, but there isn't a specific cifra of how many expired medication are sold. So what can we do to help? Well, there is the national system for the management of containers and medicine waste, in Spanish, SINGREM. And it's founded by the pharmaceutical industry, and it is at no cost at public. So they are present in 26 of the 32 states in Mexico. And we, as citizens, I'm sorry, we can identify the medication that are no longer used in a home. Then we put that medication in the container of SINGREM, which are especially for those medications. The SINGREM collects all those medications and they weight how much they've received. And for each pharmacy or clinic, or even I've seen one container at Walmart, so they weigh all. And the waste is transferred to a temporary warehouse where it's weighted and it's classified. How many antibiotics, how many painkillers, the others. And last, the waste is transferred for a final destruction. They burned all the medication that are no longer used. And that's a very efficient way for inactivate the drug that is in the medication, the principle that makes the medication work. And that be all for me. I hope you enjoy it.
Thank you, Alexia. I think what you brought out is a very, very important topic, and the responsibility is not just of the health system or the policymakers, but of every individual, because we know that how the consumption of antibacterial and such medicine is increasing, as we see during the pandemic as well. So thank you so much for bringing up this topic and reflecting your research work and how and giving us some good recommendations as well. So thank you so much. With that, I would like to now invite uh, Javier Del Yeta, a law student from University of Querétaro. He will be presenting on behalf of Izarelly Lopez, who is a medicine student from University of Querétaro, who at the age of 11 wrote her first project on denim recycling to avoid the contamination of rivers and damage to health due to ingestion of contaminated water. Uh, Over to you, Javier. I'm sorry if I'm not pronouncing the name correctly because it's Spanish and English.
Don't worry. Can I share screen, please?
Sure. Can you try now?
Now you can see the screen?
Yes.
Okay. Well, first of all, hello everyone. It is an honor to be here with Dr. Ash, Dr. Izarelly, Dr. Chris Dickey, Dr. Isidro, as well as all my fellow colleagues. Climate change has a direct influence in the social determinants of health and environment aspects. This includes drinkable or potable water, safe housing, enough or sufficient food, and clean air. The social determinants of health are the circumstances on which people are born, grow, how they work, they live, and they grow old. It also includes, as Dr. Chris Dickey said earlier, education, healthcare, neighborhood and environment, social and community context, and economic stability. According to the World Health Organization, or WHO by its syllables, the social determinants of health explain most of the health concerns. That is, the unfair and avoidable differences observed in and between countries regarding the health situation. Here we can see the relationship between the climate change and some of the diseases annually. Malaria causes 60,000 deaths per year, child malnutrition 95,000, diarrhea 48,000, the exposure to heat in the elders causes 38,000 of deaths, and if we don't do something now, if we don't make the change, between the years 2030 and 2050, we will have an additional 250,000 deaths. From data of the World Health Organization, we can see that allergens increase with heat, causing asthma. The asthma affects 300 million people worldwide. High temperatures increase ozone levels and other air pollutants, aggravating cardiovascular and respiratory diseases. Floods pollute fresh water, and this will increase eventually more waterborne diseases. Also, the rising of temperatures and the variability of rainfalls will reduce food production, and this will eventually increase malnutrition. The cost of the direct damage to health is between $2,000 and $4,000 million by 2030. And unfortunately, like my fellow colleagues have explained earlier, the places with poor infrastructure will be the least able to face these changes. In 2015, the World Health Organization approved a work plan that has 4 main impacts in alliances, awareness, science and evidence, and a response to public health and climate change. In alliances, it refers to the coordination with other UN system organizations to ensure that health is adequately represented in the climate change agenda. in awareness means to provide and disseminate information on the threats posed by climate change to human health and the opportunities to promote health by reducing carbon emission. On science and evidence, it refers to coordinate reviews of existing scientific evidence and the relationship between climate change and health to develop a global research agenda. At last, response to public health and climate change refers to the change means the need to coordinate existing scientific evidence between climate change and health, and with this, develop a global research agenda. Universities and investigation centers must impulse the application of knowledge. This in order to impulse the vinculation between health and climate change. It must be a priority, the impulse of social programs to save and protect the health of vulnerable people like climate migrants, homeless, elders, and kids. The creation of knowledge webs in order to protect the health and know the effects of climate change. At last, we would like to leave you with this quote by Barack Obama. Our children won't have time to debate climate change. They will be busy dealing with its effects. Thank you.
Thank you so much, Xavier, and thank you, Izarelly, who is not part of the panel right now, not present in the meeting. Now I would like to invite Vanessa, the pop youth mentor from the pop movement, who will be speaking for a while, and then I would like to invite Dr. Ash, senior mentor, the pop movement. Vanessa.
Thank you so much, Drishya, and thank you everybody for the invitation and for being here with all of us. So we have already heard about how climate change is directly connected with human health. Human health is essential for the balance between society, environment, and economy. If health is affected, we can find ourselves facing a social crisis. The current pandemic, COVID-19, shows us how without health, all sectors are paralyzed, having large human and economic losses. This should raise awareness. This should raise awareness to take climate action and protect our planet, protect ourselves. Environmental impact and ecosystems and human health are not separated subjects. It is evident that the destruction of the integrity of ecosystems by human activity impacts human health in a negative way. A recent report from the World Health Organization shows that a quarter of diseases in the world are due to the bad environmental conditions. This is really worrying. It is well known that since 1976, at least 40 types of emerging or resurgent diseases have been reported, and they are linked to the loss of ecosystems. Human beings are in constant contact with nature. It is clear that if nature is affected, human health will be impacted. One example of this is the current crisis that we are living with sargassum, an ecosystem that is being directly and indirectly affected from multiple factors, and as a consequence, the sargassum is becoming a huge problem for human health. Researchers are already detecting different diseases related to it and are worried about what can occur next. Also, there are some researches that demonstrates that high temperatures could affect people with narrow diseases, such as multiple sclerosis. Climate change is not a separate problem of human health. Both are extremely related. We need to stop treating this subject as something different. It's important for government, universities, and institutions to invest more on research and policies to protect health of human health, to give rules for these companies that are not conscious about effects that their waste affects to human health, indigenous, and most vulnerable communities. It is really important also to know that we need to protect these vulnerable communities because they're having affected. And so we are prepared for future illnesses. The consequence of climate change will be felt on all continents, countries, and populations of the world. As climate change progresses, the temperature continues to rise and changes in precipitation patterns will lead to increase in sea level and others. Climate change already appears to be increasing the frequency and intensity of droughts, floods, heat waves, storms, and other extreme weather events. In a study conducted by the Bulletin of the World Health Organization, it was determined that there is a major participation of countries that highly support the impacts of climate related to health impacts, but there is a lack of the necessary resources to resolve these effects of climate change. These countries assume the responsibility of reminding the world community about the consequences of climate change for people's health. This clear indicates to us that countries are not prepared for the conditions that climate change can cause on health. Well, thank you so much, Drishya, and thank you, everybody. I think this is a really important subject that we need to start working together, and we need to start taking action because we are not only affecting the environment, we are also affecting ourselves and our families and our child, and we are going to get the effects of what we are doing to our planet. So thank you so much, Drishya. Thank you so much, everybody, for having me here.
Thank you, Vanessa. Now I would like to call Dr. Ash Pachori, Senior Mentor, the POP Movement. But I would like to also mention that due to time constraint, we won't be able to take any questions. So I would request Dr. Ash to please finally conclude the session and so that we can move on to the next session. Thank you, Dr. Ash.
Thank you so much. I realize we're running out of time, but I have to say I'm very, very grateful for this opportunity. I am also extremely grateful that we have met here together today to discuss this, and I believe we need much more time. So let's just treat this as a start. And I would like to begin by thanking Dr. Izarelly for her leadership and inspiration, to Dr. Isidro, for his expertise, for his inspiration and motivation to us to address this issue. And like he rightly said, 20 years ago, there was this discussion about whether public health is an issue that we should be even talking about. And here we are now, and we need to really step on the gas and work on this issue with all earnesty, zeal, and urgency. I want to thank Dr. Chris Dickey for his incredible intervention, and also to thank him very, very much for bringing up a whole range of issues, including those that are related to social determinants of health and the interconnectedness. I just want to say that the POP movement truly, echoes and lives, breathes, and talks and acts upon the issue of interconnectedness. We truly believe we're a global family, and there's just no way. One thing, if anything has taught us that one part of the world hurts, every part of the world hurts, is COVID. But I just want to say that that COVID is going to be mild in comparison to what lies in store for us if we don't urgently, and I can't underscore that word enough, address this issue. And so I also have a proposal which I will humbly present as I conclude. But I do also want to say, Dr. Oscar, Dr. Mauricio, thank you for your, not only for your presence, for your deep commitment to this issue. I've had the good fortune and the great blessing of interacting with you extensively. And I hope truly that this is something that we will do with much more earnesty going forward. I feel deeply inspired by Alexia, Javier, Izarelly, Lopez, who I know is not with us, and Vanessa, and the many young people I know who are here might not have spoken, but I know their hearts are in this subject. We've had much opportunity to talk about it, and I just want to thank all for being committed to this issue and being invested in this issue, and also acting. I want to say that climate change is truly a global health emergency, and we need to treat it as such and work on it with that spirit and the togetherness, which is the only way we'll really be able to tackle this issue and do so now. And so I want to thank all of you for your leadership and your inspiration to us, for your practice, for your research. And we need work across different spheres in order to be able to address this. This is a multidimensional issue, and it affects all of us literally across every sphere of our lives. And Vanessa brought that up as she spoke about how this is going to really affect us and every generation to come unless we deal with it on an urgent basis right away. So here's my very, very, very humble proposal. And that is to say, could we forge a partnership, Dr. Izarelly, Dr. Isidro, and I'd like to also very humbly request Dr. Chris Dickey and all of the amazing leadership that we are so blessed to be together with here to come together and launch a climate and health initiative where we bring together the important voices, the research, and the action, and follow it up on the ground to make the change we need to make. My field of work is public health, and I've been closely invested in working together with WHO in Geneva, and our point person there is also very, very invested in the issue of climate and health. And I will extend a humble invitation to her as well, Dr. Manjula, if she would agree. But I present this idea to you and invite you, please, to come together with us so that we can launch an initiative and really take this forward. We need to move beyond dialogue to action. And so it's a very humble proposal. And with this, I shall hand to Dr. Izarelly. Please, if you would like to say a few words, but I present this proposal to you with all my heart. And thank you from my heart to yours. I'm so honored and I'm so privileged, but I want to say I'm deeply inspired by today. And I hope that, this is the start and we'll take this forward. Thank you. Thank you so much. With that, I hand back to Dr. Izarelly, Dr. Isidro, and Dr. Chris Dickey. Thank you so much. And I look forward to hearing from you. And I hope we forge forces as a global family. Thank you.
Thank you, Ash.
I look forward to hearing from you and from our esteemed guests here. So I hope we can come together and launch this initiative together now, soon, and kick off work. So over to you, please. Thank you.
Well, I would just add, I think thank you very much, Ash, for those comments. And I think your vision is a great one, and it's also quite inspiring. I would just suggest that maybe our Applied Global Public Health Initiative, which is a partnership between NYU and the University in Querétaro, to maybe take this on. It's something that we're uniquely positioned to be able to do, to work with you on. And so I think we'd be delighted to do that.
We're deeply privileged and honored, and thank you so much for your leadership, Dr. Izarelly, for your leadership, Dr. Isidro Gutiérrez, muchas gracias. And I just want to thank you for your, your zeal and the push to make it happen. Thank you, Dr. Dickey. We were eagerly looking forward to taking this forward with you and together. Like I said, we're connected and we bring our minds, hearts, and souls together as a global family to make this happen. I'm really looking forward to the follow-up. Thank you. Dr. Isidro, over to you, please.
Thank you very much for the opportunity. And I think, as Dr. Dickey says, we have an amazing opportunity to take care of this. We had this group that is already interconnected between NYU and Querétaro University that is gladly taking care of this initiative with your support and with the union of all these young leaderships that will be doing the work. So as the jellyfish said, let's put brain and heart in this.
Thank you, sir. Thank you. So I know my video doesn't come on, but I'm folding my hands and conveying my gratitude from my heart, honestly. And thank you so much. I'm really eagerly looking forward to this, and I shall follow up diligently to make this to bring this to fruition. Thank you.
Thank you, Ash.
Together with you. Gracias, doctora.
Thank
Por
you.
favor.
It's very important for the Querétaro University to promote with the POF movement the initiative in climate change and health. For the for Teresa Gasca, Rectora, is very important this action for the work. And it's important said that the POP movement, the following students for the POP movement in WAC is the Patricia Ledesma Gómez de la Cortina, Mauricio Rodríguez de la Cruz, Javier de la Llata Septien, Bernardo García Rugama, Christopher Gutiérrez, and Izarelly López Rosillo is the students for the POP movement Mexico in Querétaro for the Querétaro University. Thank you very much, Ash, and Dr. Isidro and Dr. Cruz.
Muchas gracias, doctora. I'm deeply honored and I'm so privileged to have this opportunity. I look forward to following up with you to work on this, and I want to thank the entire family from NYU, from the University of Querétaro, and the leadership that Doctora Rectora Margarita provides to us. Thank you all ever so much, and so looking forward to the future that lies ahead. Thank you. Gracias. Gracias de mi corazón. Muchas gracias.
I once again would like to thank all the experts and the young professionals for coming today and making the presentations and bringing us all together at a platform where climate change, the issue of climate change and public health can be connected and can be conveyed in certain manner. And Dr. Ash for proposing that amazing initiative. Thank you so much. With that, we would shift to the next session. And Vanessa will drop the link in the chat box if the audiences would like to join it. The next session will be in Spanish. So thank you, Vanessa, for dropping the link in the chat. And I would like to close the session. Thank you so much once again.
Thank you.
Thank you.